Welcome back to our Doc to Us podcast, Health Tips Weekly, episode 20. At the time of recording, there are approximately 41,000 active cases of COVID-19 in Malaysia. Besides the jaw-dropping number of cases reported in the urban area, COVID-19 outbreaks were also detected in the rural area, where the lack of healthcare services is a huge concern. The Director General of Health Malaysia, Tan Sri Dr. Noor Hisham Abdullah, pointed out that for the first 9 months of the year 2020, the total deaths associated with COVID-19 were less than 100. However, we have already achieved 71 death cases in just the first 9 days into 2021. Guys, this doesn't look good at all. While most people with COVID-19 recover and return to normal health, some COVID-19 survivors can have symptoms that can last for weeks or even months after recovery from it. This is to say that even after COVID-19 survivors were discharged from the hospital and thought that, it's all over, well, it's not. Tens of thousands of people in the United States have such lingering illness following COVID-19. In the United States, they call it as the long hauler, while in the United Kingdom, they are said to be suffering from the long COVID. Indeed, published studies have indicated that 50 to 80% of the patients continue to have bothersome symptoms 3 months after the onset of COVID-19, even after tests no longer detect virus in their body. If you think that only individuals with severe COVID-19 suffer from long-term consequences, that's not true. Even people who are not hospitalized and who have mild illness can experience persistent or late symptoms. In today's episodes, let's find out what awaits the COVID-19 survivors. One of the most commonly reported sequelae of COVID-19 infection is persistent fatigue. A study conducted in Wuhan, China, found out that 63% of the COVID-19 patients that they studied experienced fatigue within 6 months after being discharged from the hospital. BBC reported that Jade, a COVID-19 survivor from the United Kingdom, quoted saying, "My fatigue was like nothing I've experienced before." For the record, she's only 32 years old, living a healthy lifestyle as she goes to the gym 3 times a week, and only had mild symptoms of COVID-19 infection. Other studies also confirm that persistent fatigue following COVID-19 infection is a common symptom, regardless of the severity of the disease. Just imagine going from your young, energetic self to become someone who is always tired and feeling fatigue. And no, this persistent fatigue is not the same as the one you experience after watching a whole night of K-drama and go to the work the next morning. It can be so debilitating that it affects your work performance, your personal safety, and even your ability to enjoy your life. COVID-19 infection is a viral infection that affects primarily, but not exclusively, the airway and the lungs. It can cause things ranging from mild upper airway symptoms that are similar to flu to progressive life-threatening pneumonia. But how does COVID-19 damage your lungs? Well, our lungs contain millions of tiny air sacs called the alveoli. They are like balloons that fill with air, and you count on these alveoli to contain oxygen for you and to pass the oxygen to your bloodstream to be used by your entire body. COVID-19 infection can cause these alveoli to deflate or collapse. Some of these infections progress to acute respiratory distress syndrome, in which those alveoli will fill with fluid. Once the alveoli deflate or fill with fluid, they can no longer be filled with oxygen, so your blood now is low in oxygen and you're at risk of lung failure. As a result, COVID-19 survivors can also experience long-term breathing problems such as shortness of breath or breathlessness, as well as chest tightness and coughing. By examining the lungs of some COVID-19 survivors, scientists have confirmed that some COVID-19 survivors indeed suffer from lung injury and deterioration in lung function. After a serious case of COVID-19, a patient's lungs can recover but not overnight. When there is an injury to the lungs, it can be followed by scarring, and over time, the lung tissue heals, but it can take 3 months to a year or more for a person's lung function to return to the pre-COVID-19 levels. While it primarily affects the lungs, SARS-CoV-2, the virus that caused COVID-19, is not satisfied with just damaging one lungs. Some COVID-19 survivors experience long-term consequences which are not lung-related, such as multiple organ damage. A study on young low-risk population with COVID-19 infection shows that almost 70% of them have impairment in one or more organ 4 months after the first symptoms appeared. The reported organ damage includes those at the heart, kidney, liver, pancreas, and the spleen. Kidney is one of the main targets of COVID-19 unpleasant sequelae. Many of the severely ill COVID-19 patients died because of kidney failure. One of the reasons is the cell at the kidney contains the entrance door, which is called ACE2, that helps SARS-CoV-2 to gain entry into our body system. Once SARS-CoV-2 enters into the kidney cell, they destroy them mercilessly and set off a chain of inflammatory events that further damage the kidney tissue. Another important organ is the heart. It's also not spared from COVID-19. A growing number of studies suggest that COVID-19 survivors experience some type of heart damage, even if they did not have any underlying heart diseases and only had mild COVID-19 infection. A study that looked at the heart of 100 COVID-19 survivors found that 78% of them have some abnormalities in the heart, and 60% of them have heart inflammation. What that means of these people is that they may end up feeling fatigued and exhausted. Also, they may not get up to the active level they were at before. Things could be even worse for those who have underlying heart disease. You thought that's all? No. COVID-19 seems to affect how our brain works too. I feel like I have dementia, said Mr. Mizal, a 53-year-old COVID-19 survivor, in an interview with the New York Times. A small group of COVID-19 survivors experienced what is known as the COVID-19 brain fog, which includes memory loss, confusion, difficulty focusing, dizziness, and grasping for everyday's words. Increasingly, COVID-19 survivors say that brain fog is impairing their ability to work and function normally. Experts say that some of these symptoms they are experiencing are thought to be caused by postural orthostatic tachycardia syndrome, which is a blood circulation disorder. The inadequate control of blood flow leads to the brain fog, increased heart rate, and severe long-term fatigue. Not that we want to scare you, but it appears that COVID-19 can also cause neurological and psychological problems as consequences. One of the first spectroscopic imaging-based study of neurological injury in COVID-19 patients found that the severity of neurological symptoms varies, ranging from one of the most well-known, a temporary loss of smell, to the more severe symptoms such as dizziness, confusion, seizure, and even stroke. A study in the UK found that persistent fatigue, breathlessness, psychological distress were commonly reported at 7 weeks after COVID-19 survivor discharged from the hospital, with many of them experiencing a significant drop in their quality of life. Unfortunately, life after COVID-19 may not be rosy for some. A handful of them struggled with mental health disorders such as anxiety, depression, insomnia, and post-traumatic stress disorder. COVID-19 infection has caused tremendous suffering, and guys, we haven't even talked about its effect on the frontliners, healthcare professionals, and those who were impacted by the economic downfall. Many of the symptoms we mentioned can happen regardless of the severity of COVID-19. You can imagine just how bad things would be for those who suffered from severe COVID-19, especially those who required mechanical ventilation to breathe. In fact, many COVID-19 patients on ventilator will not survive, and the survival rate is even slimmer for elderly patients who required mechanical ventilation. There are so many uncertainties about life after COVID-19. For example, we don't know who will be more likely to develop long COVID. Research is still underway to differentiate symptoms of a prolonged course of COVID-19 illness and how it is best to be managed by a healthcare professional. Nevertheless, it's clear that regardless of your age, health status, and the severity of COVID-19 infection, you can suffer from long-term health effects from the infection. We should be cautious of seeing COVID-19 as an acute short-term infection. It is best to view it as a potential long-term illness for some people, and those people may be you or your loved ones. Life after COVID-19 can be pretty tough for some individuals. Hence, we should never discriminate against COVID-19 survival. Remember, stigma hurts everyone by creating more fear or anger towards ordinary people instead of focusing on the disease that is causing the problem. Stigma can also make people more likely to hide symptoms or illness and keep them from seeking healthcare immediately and prevent individuals from adopting healthy behavior. The last thing we want when controlling a pandemic is to have social stigma get in the way of the effort. Let's cultivate empathy and caring for COVID-19 survivors. Most importantly, we should all play our part. Wash your hand, wear a mask, follow the SOP, social distancing, and avoid crowded places and close contact. And you should also get tested when indicated. If you have any inquiries related to the COVID-19, you can consult our COVID-19 task force, which consists of professional doctors and healthcare professionals for free. You can access the free COVID-19 virtual health advisory by downloading the Doctors app or through My Sejahtera app. Stay safe and let's fight off the pandemic together. Bye!